All right, let's jump right in. Today, we're going to tackle something that affects a ton of patients but is almost never explained well. The real side effects of low-dose naltrexone, also known as LDN. We're going to slice right through all that confusing medical speak and get to what you can actually expect.
Listen to this. This is something a real patient, we'll call him Robert, actually said just 4 days after starting LDN. Now, what he was feeling, yeah, it was super alarming for him, but it wasn't actually dangerous. He was just going through something that nobody had really prepared him for.
You see, what Robert went through with those dreams, that is, hands down, the #1 side effect of LDN. So, that's what we're going to do right now. We're going to pull back the curtain, demystify what's happening, explain why it happens, and, most importantly, show you what you can do about it. Let's get into it. This is where we hit a massive communication gap, right? You know, when a doctor says a side effect is mild, they usually just mean you're not going to end up in the hospital. But for you, the patient, waking up at 2 in the morning completely confused about what's real and what's a dream, that feels anything but mild. It's alarming. And that disconnect is at the very center of this whole issue. And that really brings us to the heart of the matter here. What you read in the official textbooks or medical papers, it paints one picture of LDN side effects, but what doctors are actually seeing with their patients every single day, whoa, that tells a totally different and way more accurate story. Okay, just look at this table. The difference is pretty wild. See this? The official literature calls vivid dreams uncommon. But in reality, we're talking about up to 37% of patients. And it's the same story down the line. Insomnia, headaches, fatigue, all of them happen way more often than the data will have you believe.
Now let's just pause on that number for a second. 37%. That's more than 1 out of every 3 people who start LDN. This isn't some weird, rare thing. It's literally the most common side effect, and somehow the most underreported one.
So you're probably asking, why? Why is the gap so huge? Well, it really boils down to how they collect the data. In a formal clinical trial, they typically only record really severe side effects that a patient brings up on their own. But in the real world, a doctor will actually ask you, hey, how are you sleeping? Any weird dreams? And that's when we get the real picture.
All right, so if these dreams are happening to so many people, what is actually going on in the brain? It's time to dig into the science. Turns out it's not random at all. It's actually tied directly to how LDN works its magic in the first place.
Let me break it down for you. It's called the endorphin rebound effect. First, LDN puts up a temporary roadblock on your endorphin receptors for a few hours. Your brain senses this and goes, whoa, we need more endorphins, and starts pumping them out like crazy. All of this extra endorphin activity happens while you're asleep, which totally supercharges your REM sleep. And the result? Those hyper-realistic, unforgettable dreams.
Now, here's the really important part. This whole dream thing, it doesn't last forever, not even close. Just look at this timeline. It's super intense for the first week or so. That's the peak. But then your brain starts to figure things out and adjust. For most people, by week 4, your dreams are pretty much back to normal. Just knowing that can be a huge relief.
So, when we say vivid dreams, what does that actually feel like? People have said it's like watching a movie in Ultra HD, or that they can actually read stuff in their dreams, which is wild. You might have these incredibly complex stories happening all in one night. And yeah, they're emotionally intense. But here's a key point. They're not usually nightmares, just a lot.
Okay, so we've talked a lot about the what and the why. Now for the most important part, the how. How do you deal with this? The great news is you're not just stuck with it. There are simple, really effective things you can do to manage it all. This is the question, right? What can I actually do if this gets to be too much? If the dreams or the insomnia are just too disruptive? Well, like I said, you have options, really good ones.
And that's the key takeaway here. You're in the driver's seat. Just look at this first strategy, earlier dosing. A 60 to 70% success rate just by taking it a few hours earlier. That's huge. And if that doesn't work, you can try going up in dose more slowly. Or, if things are really intense, a temporary dose reduction has an 80 to 90% success rate. You've got tools in your toolkit. Okay, let's switch gears for a moment to talk about safety and the big picture. First, there's a critical warning we have to cover. And second, we need to put LDN side effects in context. Because honestly, when you put them next to some of the other common drugs out there, it's a very different story.
All right, I need everyone to listen up for a second. This next part is absolutely critical. This is the one thing you cannot, under any circumstances, get wrong if you're taking or even thinking about taking LDN.
Here it is, you can never, and I mean never, combine low-dose naltrexone with any kind of opioid medication. That means things like oxycodone, tramadol, even stuff like kratom. Because LDN's job is to block those receptors, taking them together will trigger immediate and really severe opioid withdrawal. It's dangerous, so don't do it.
Okay, now let's put all of this into perspective. Remember how we said the side effects of LDN, like the dreams, are usually gone in a few weeks? Well, now look at a common alternative for something like fibromyalgia, a drug like pregabalin. You're looking at dizziness in almost a third of people, sedation, weight gain, and these things can be long-term issues. The context here is really, really important.
So that brings us to the final question, and it's something I really want you to think about. Is the issue really the side effect itself, or is the real problem the fact that we're not preparing people for it? Because when patients like Robert know what to expect and they have the tools to manage it, well, that changes everything, doesn't it? That's the key to making LDN work.